guarantee that marirecord siya. Okay? So, recording na po ba? Ayan. So, already recording. Okay? So, I will also be sharing this if ever mag-succeed siya sa pag-save sa aking device. I'm going to share this with the other section. Okay, so let's start with head injury. No? So, we define head injury as any trauma that leads to injury of the skull, or brain. So the injuries can range from a minor bump on the skull to a serious brain injury. Okay, now moving on. So this is how, or um, these are the common types of head injury, no? Yung nabagsakan ka, yan. So, the manifestations or the complications will really depend on the severity of the injury, the location or the part of the brain that has been injured, okay? And of course, the prognosis also depend on the part of the injury or part of the brain that is injured and the severity of the injury or the impact, no? So, yeah. Okay, so of course, just a quick overview of the brain. The brain is the control system of the body, no? It controls all functions in the body. So once the brain shuts down, all other systems shut down as well. And we have discussed in the previous topic, which is nursing management for the unconscious clients, that the brain is the organ primarily responsible for maintaining consciousness. Okay, so one of the most common manifestations of head injury is the changes in sensorium or the change in the level of consciousness, because it will give us an idea of the severity, no, of the injury. So kapag prolonged yung unconsciousness niya or prolonged yung alteration ng level of consciousness niya, it will give you an idea na severe, no, yung injury, as opposed or as compared to when nag-faint lang siya. And of course, you can never tell, because one thing na mahirap for brain injury is that we, unlike the other parts of the body, na yung mga manifestations nila is abrupt. For head and spinal injury, there are instances wherein gradual, no, yung pagworsen ng kanilang signs and symptoms or yung pagworsen ng severity, no, ng status ng patient. Okay, so sabi ko nga kanina, now you have there the different parts, no, major parts of the brain, and it depends on which part is affected. Okay? So, yan. Now, so, this one on your screen right now is the incidence of head injury. So, it is the number one killer in trauma. Primarily because, if you have a fractured a bone, like for example in your femur or in your humerus, for example, your long bones, no, sa body. Yun kasi as long as there is a prompt intervention or treatment and nakokontrol yung bleeding and there is no complication of infection, nagagawan ng paraan, mabilis. Okay, unlike for the brain, it's really hard, especially if a part of the brain has been severely damaged. You know that the brain cells do not regenerate. No, they do not regenerate, and because they do not regenerate, healing can be very difficult, no, sa brain. Okay, and ang head trauma kasi, especially if ay talagang poor yung prognosis as compared types of injuries. So this is why it is Sorry po, I think na na-disconnect ako doon. Yeah. So, okay, now we continue with the different types of brain injury. We have acquired brain injury and traumatic brain injury. So, for acquired brain injury, it is an injury to the brain that occurs after birth. Okay? Many different factors can cause an acquired brain injury. So, ano-ano yan? We have anoxic injuries, so prolonged lack of oxygen, hypoxia or there is decreased oxygen flow. So alam nyo yan, balik tayo dun sa basics natin that when cells are deprived with oxygen, they die, no? Nagkakaroon ng ischemia, magpo-progress yan ang cellular injury and the domino effect na yan. Okay, so once the brain is deprived of oxygen and once there is a prolonged deprivation of oxygen, you expect for a brain injury. Okay, so epilepsy or other seizure disorders, strokes, brain tumors, cerebral ischemia, infections such as encephalitis or meningitis, and neurotoxic events. Your neurotoxic events, these are situations wherein a person is exposed to toxic chemicals or drugs, and hydrocephalus. So these are the common causes or factors contributory to acquired brain injury. Now, how about traumatic brain injury? So, kanina, it's more of internal factors, no? It's more of a complication of disorders. Okay? So, ngayon naman, if you say traumatic brain injury, it is caused by external physical force. Okay? So, siglit lang. Yan. So, the injury occurs when a blow to the head or body causes the brain to move rapidly inside the skull. So, the impact and movement can injure brain cells, nerves, and blood vessels. So, yung acquired brain injury kanina, it is commonly acquired at birth. Sino yung common na nagsasuffer nito? Yung mga newborn rather. So kapag ka nagkaroon ng hypoxia, nagkakaroon ng prolonged labor, pag nagkaroon ng prolonged labor, nagkakaroon ng tawag dito, nako-compromise no yung blood flow and nako-compromise yung oxygen sa brain. So nagkakaroon ng brain injury. Meron din yung it is caused by infection and other disorders. It's more of a complication. Kapag dito tayo sa traumatic brain injury, this is caused by external physical force. So ito na yung nai-imagine nyo. Kasi 'di ba kapag narinig nyo yung word na head injury or brain injury, ito mas pumapasok ito yung more common na naiisip natin, okay. Ito yung napukpok sa ulo, ito yung nadisgrasya, nabagok yung ulo. So, yun yung common notion natin. And less sa atin na pumapasok yung or susunod na lang yung other type which is the acquired brain injury. Now, sabi ko kanina, the prognosis no of brain injury as well as its severity depends on which part of the brain has been injured. Secondly is the severity or the impact of the external force to the brain. Okay? Ayan. Now, we have classification of traumatic brain injury based on their location. Okay, so first we have epidural hematoma. With an epidural hematoma, the bleeding is located between the dura mater and the skull. Okay, so saan na ulit yon? Reviewin natin. Yan. Okay. So this one is your epidural hematoma. So kung makikita nyo yung red side dito, or yung red part, wait lang, I'm going to highlight this one. So kung makikita nyo to, this part, so this is where the injury is located. So kaya makikita nyo, it's color red because there's bleeding. There's evidence of bleeding. At kung makikita nyo dito part, nako-compromise ngayon yung brain, no? Nako-compress yung brain. At pag na-compress yung brain, ano yung nangyayari? Nagkakaroon ng increased ICP, 'di ba? And most of the manifestations of brain injury ay ang cause niya is dahil nag-i-increase yung ICP. Not only that, if there is an injury in any part of the body, not only sa head injury, there is always a succeeding hematoma and edema. No, pag nagkakaroon tayo ng edema, if there is edema, then there is swelling of the brain. If there's swelling of the brain, there's increase in ICP. Okay, so this is your epidural hematoma. Okay. So moving on, your subdural hematoma. So a subdural hematoma is located beneath the dura mater. Sub means below, between it and the arachnoid mater. So if you look into it, so ito naman siya, no? So it's below your dura mater. Okay. Yan. Another one is your subarachnoid bleed. So subarachnoid bleeding occurs in the space beneath the arachnoid layer where the cerebrospinal fluid is located. It is often there is intense headache and vomiting with subarachnoid bleeding. Yan. So this one is your subarachnoid hemorrhage. Yan. And your intracerebral bleed. So yung intracerebral bleed, this one, there is an actual bleeding on the brain tissues. Okay? So meron talaga siyang actual sa mismong brain tissues na. And okay, so another one, another way to classify traumatic brain injury is on the cause. Okay, so kanina location, based on location, tayo naman ngayon on the cause. Sometimes the damage is due to shear injury where there is no obvious bleeding in the brain, but instead the nerve fibers within the brain are stretched or torn. Yan, this one is your shear injury. Yan, so this one, no, kung makikita nyo, this is an example of your neuron. Okay, these are the different types. You have your axon, we have cell body over here, and then you have your tiny projections, your dendrites. So usually kapag nagkaroon ng shear injury, no, nai-stretch or nagkakaroon ng undue stress dun sa neurons, kaya because of this force, no, nagkakaroon ng injury. Okay, so this is your shear injury. Okay. Edema. Okay. Sorry po. All injuries to the brain may also cause swelling or edema, now different than the swelling that surrounds a bruise on an arm or leg. So, sabi ko sa inyo to kanina, lahat naman ng injury nagkakaroon talaga ng edema. This is common, no, to all types of injury. Ganon din sa head, no. So one of the priorities in treating head injury is to lessen the edema, no, to relieve the edema, because the edema is causing the increase in intracranial pressure. Ayan. So, ito nangyayari pag nagkakaroon ng swelling doon po sa brain. Okay. So, if there's swelling doon sa brain natin, nag-increase yung ICP kaya nagkakaroon ng manifestations. Another one is your skull fracture. So, the bones of the skull are classified as flat bones, meaning that they do not have an inside marrow. So it takes a significant amount of force to break the skull. So it's one of the strongest bones in the body, di ba? Yung skull natin. Kasi it has no spongy cells na tinatawag. So compact lang siya. Okay? It's made up of compact bones. Unlike your long bones, for example, no, na meron siyang ang tawag dito, meron siyang cavity, meron siyang marrow na yung inside of the bone is more vulnerable or kaya naman less strong than the outside. Okay? Or the surface. Kasi yung surface ng mga long bones natin made up of compact bones, no? Ayan. So your skull is strong kaya pag nababagok ka hindi agad-agad, no, na it doesn't immediately result to a skull fracture because it is really strong and compact. So it takes a significant amount of force to break the skull, and the skull does not absorb any of that impact. It is often transmitted directly to the brain. So yun naman yung mahirap, since the skull is compact. Once there is a force, no, na directly, no, introduced to the skull, it's being absorbed by the brain. So ayan. Grabe naman yung nangyari sa fracture na to. Nakakatakot, no? So most of the time nangyayari to, common ang skull fracture for or during your vehicular accidents, no? So etiology, we have falls, motor vehicle crashes, penetrating head injury caused by bullet, sports injuries, and assault and violence. So, most of the time, na-encounter nyo tong mga to sa emergency department or sa emergency room. Or kaya naman, if later on, no, you're going to pursue a career in emergency response, yung mga rescue, ganyan. So, most of the time, kayo yung pupunta doon. So, ito yung mga mostly na na-encounter. So, what are the different symptoms of head injury? So, initial symptom, sabi ko sa inyo kanina, basta na-involve ang brain, ang laging manifestation is change in mental status, change in the level of consciousness, meaning an alteration in the wakefulness of the patient. There may be loss of consciousness, lethargy, and confusion. It depends on the severity of the injury. Ayan. So, main symptoms, yan. So, one of the manifestations is your battle sign. So, this is an ecchymosis or redness over the mastoid area. So, ito siya on your screen, no? Yan. Okay, we also have raccoon's eyes. So, sorry po sa spelling, no? Tsaka hindi ata niya na-read yung aking picture. So, alam niyo naman what raccoon's eyes is. This is not your first time you have encountered these signs and symptoms in other disorders. So, persistent localized pain for skull fracture. No? For concussion, so pag concussion lang siya, there is temporary loss of neurologic function with no structural damage. While for contusion, there is moderate brain injury in which brain is bruised and damaged in specific area. We also have what we call post-concussion syndrome symptoms. So ano tong mga to? We have headache, dizziness, anxiety, irritability, and lethargy. So ulitin natin, if there is a skull fracture, you expect that there is persistent localized pain. For concussion, this is less severe compared to the other types. So there is temporary loss of neurologic function with no structural damage. For your contusion, moderate brain injury in which brain is bruised and damaged in specific area. And you have there your post-concussion syndrome. You have headache, dizziness, anxiety, irritability, and lethargy. So these are the other signs and symptoms. We have vomiting, difficulty tolerating bright lights, leaking cerebrospinal fluid from the ear or nose, bleeding from the ear, speech difficulty, paralysis, difficulty swallowing, and numbness of the body, dizziness, irritability, difficulty concentrating and thinking, and amnesia. So it depends. Usually kapag po ang affected part is your occipital, you expect that there is a problem with vision. No, if ang affected diyan is your frontal and your temporal, you expect for a problem in speech, a problem in memory, no? Kaya nagkakaroon ng transient amnesia na tinatawag, no, yung temporary amnesia. Okay? So, diagnosis, how do we diagnose head injury? We do history taking, physical examination. So I think I have discussed this in our previous topic, which is unconsciousness, no? Yung Glasgow Coma Scale. Glasgow Coma Scale. So your Glasgow Coma Scale is the most commonly used tool in assessing level of consciousness among patients with brain injury, okay, and other disorders affecting the brain. So kasi nga one of the ways or the most reliable way to assess the brain function is to assess the level of consciousness, so that if there's a problem with the level of consciousness, it implies that there is a problem in brain functioning. So neurological examination, CT scan, PET scan, and your X-ray. Okay, so just a review. I have discussed this with you in the past or in the previous topic. No, this is your Glasgow Coma Scale. Of course, we have your eye-opening, verbal response, and motor response. No? So these are the three parameters that we look into when we assess for the Glasgow Coma Scale. Okay, what are the complications of brain injury? We have brain death, which is irreversible end of brain activity. So at tinatawag natin, brain dead na siya. It's only the machine that's keeping him or keeping her alive because the brain is no longer functioning. Okay? So post-traumatic amnesia, dementia or loss of brain function, aphasia, tinnitus, meningitis, post-traumatic seizure, sorry po sa spelling ng seizure, ataxia, and coma. So what are our immediate management? No? So unless the airway is blocked, do not move the person until the medical team arrives and checks for spinal cord injury. So it's very important, both actually for brain injury and spinal cord injury, to immobilize the patient. No, do not make unnecessary movement on the body of the patient because you might aggravate an existing injury. Okay, so do hands-only CPR if necessary. If the person is unconscious or not breathing, do only chest compression. And for an adult, start adult CPR. For a child, start CPR for children. So take note that this is already a brain injury, but we still apply the ABCs in prioritization. So always check for the patency of the airway, for the breathing, and for the circulation. Okay, so that's what matters most. Kasi even if this is a head injury, ma'am, head injury naman po yun, but the more na magiging severe yung effects niya or yung impact ng head injury, if you will not be able to restore breathing and circulation promptly. Kasi the longer the time that the brain will be deprived of oxygen, the worse the prognosis will be. So for mild or moderate head injuries, to control bleeding, apply clean dressing directly to scalp or facial cuts. To control swelling, apply ice for 20 to 30 minutes every 2 to 4 hours. And for headache, give over-the-counter acetaminophen. Do not use aspirin, ibuprofen, or other inflammatory drug, which can increase the risk of bleeding. So, if there is mild or moderate head injury, our primary consideration is to control the bleeding and to control the swelling. Because alam naman natin pag sinabi mong bleeding, you're losing a lot of blood. Another one is a bleeding that is confined inside the brain could result to increase in ICP, compression of the brain, and everything else follows. So, ganun din naman doon sa swelling. And of course, in order to relieve pain, we give acetaminophen. We do not give anti-inflammatory drugs which may put the person at greater risk of bleeding. Okay. So what are the different medications? Of course, we have mannitol. Alam nyo yan. We give mannitol in order to decrease yung swelling, yung i-decrease natin yung intracranial pressure. So, usually, yung dosage ng mannitol natin is 0.25 to 1 gram per kilogram of body weight. So, this is a osmotic agent that decreases ICP, and also maintain your CBF, your CPP, and your brain metabolism. It decreases ICP within 6 hours and expands volume and oxygen carrying capacity. Okay, so that's your mannitol. Now, primary consideration when giving a mannitol, always check the blood pressure before giving because mannitol can lead to hypotension. So if your patient is already hypotensive, you need to refer this to the physician so that the physician may reconsider holding mannitol temporarily, because if you insist on giving mannitol despite the very low blood pressure, it may lead to severe hypotension. No, so nursing consideration natin in giving mannitol, check the vital signs, especially the BP, before and after giving. Another one is your furosemide. It also reduces ICT in conjunction with mannitol. So the dose is 0.3 to 0.5 milligram per kilogram of body weight. Never using patient with hypovolemia. You know already why we cannot use furosemide for hypovolemia, because your furosemide is anti-diuretic. So if it is anti-diuretic, it promotes elimination of fluids from the body, di ba? So through urination, kapag ka nag-decrease yung fluid volume at may hypovolemia pa yung patient mo, mamaya mag-result yan to hypovolemic shock, no? So we also need to consider the other disorders that the patient has. So kapag ka-contraindicated siya, hindi talaga siya binibigay. So the same as mannitol, when we give furosemide, we also check for the vital signs. So usually after 3 days of using furosemide, physicians normally or usually order for repeat potassium tawag dito, test, no? Pinaparepeat yung potassium test. Bakit? Review ulit natin. Furosemide is a diuretic which is potassium wasting. So one of the complications or side effects rather of furosemide is hypokalemia, no? Ayan. So makikita nyo kapag yung may mga prolonged patients who have been using furosemide for a prolonged duration, naka K-lite sila, kalium durol, or yung mga potassium supplements in order to prevent hypokalemia. And if there are cases of hypokalemia, depending on how decreased it is, no, kung gaano siya kababa, nagbibigay sila ng potassium chloride. Okay? So yan. So barbiturates, this is effective in reducing ICP, refractory to other measures, and not used in the presence of hypotension or hypovolemia. Okay? Another one is your phenytoin. Loading dose natin 18 to 20 milligram per kilogram. Maintenance dose 100 milligram per or every 8 hours. Okay? So any questions so far before we continue? None, ma'am. No questions so far. Are you sure? Okay, none po. Sige, let's proceed. Okay. These are the surgical management for head injury. Scalp, wounds, cleaning and debridement, elevation of depressed fractures, craniotomy and evacuation of hematoma, cranial decompression for reduction of ICT, and burr hole evacuation. So, depende kasi siya sa location ng bleeding, depende siya sa location ng injury, on which part of the brain, and up to what extent, no, gaano ka extensive yung affected part ng brain. So, these are the common surgical procedures. Okay, nursing management, of course, we assess. We obtain baseline data and immediate health history. We assess the time of injury, kailan, the cause of injury, direction and force of blow, determine the level of consciousness by Glasgow Coma Scale, and check for the vital signs. We also determine the ability to respond to verbal commands, pupillary response to light, status of corneal and gag reflexes, and motor function. We also perform neurological system assessment, psychological and emotional response, assessment of full body system, your physical exam, and assessment for the presence of injury. So what are our priority nursing diagnosis? So ineffective airway clearance and impaired gas exchange related to brain injury. Ineffective cerebral tissue function related to increased ICP and decreased CPP. Deficient fluid volume related to level of consciousness and hormonal dysfunction. Okay? Yan. So, we also have imbalanced nutrition, less than body requirement related to metabolic changes, fluid restriction, and inadequate intake. Risk for injury related to seizures, disorientation, brain damage. Potential for impaired skin integrity related to bed rest, hemiparesis, hemiplegia, and immobility. Potential for disturbed sleep pattern related to brain injury and frequent neurological checks. So these are our nursing interventions. We monitor for declining neurologic function. We assess level of consciousness and its management. We assess for the vital signs, motor function, maintaining airway, monitoring fluid and electrolyte balance. We also promote adequate nutrition. We prevent injury. We maintain body temperature, maintain the skin integrity, and improve cognitive functions, prevent sleep pattern disturbances, and monitor and manage potential complications. Yan. How do we prevent? We always educate our clients to put on their seat belts, make sure that their airbags are working. Alcohol and drug use must be prevented, so strictly no alcohol when driving. Helmets must be worn rather if or for those who are riding on a motorcycle. Prevent falls for other adults around the house. How do we prevent falls? So, common kasi ang injury among elderlies. So, if you have elderlies at home, you make sure to install handrails in bathrooms. Ito yung more common or most common site of or area where our elderlies suffer from injury kasi nadudulas sila sa floor sa bathroom. Put a non-slip mat in the bathtub or shower. Install handrails on both sides of staircases, improve lighting in the home, keep stairs and floors clear or clutter, get regular vision checkups, and get regular exercises. How do we prevent head injury among children? So, eto naman, effective naman tong mga health education na to among our mothers, especially those who have toddlers at home. So install safety gates at the top of stairs, keep stairs clear or clutter, install window guards to prevent fall, put a non-slip mat in the bathtub or shower, and don't let children play on fire escapes or balconies. Okay. If there are no questions, let's proceed with spinal cord injury. So a spinal cord injury is any damage to any part of the spinal cord or nerves at the end of the spinal canal, which often causes permanent changes in strength, sensation, and other body functions below the site of the injury. Take note of the word below the site of injury. So, ito po siya, usually po yung mga manifestations po ng spinal cord injury is below the affected part of the spine. So, basic anatomy, this is your spinal cord, an example of your spinal cord. Incidents, primarily more common among males. And, ang tawag dito, half of these injuries result from vehicular accidents. 2/3 of patients with spinal cord injury are less than 30 years old. Why? Kasi kung makikita mo yung or kung titignan mo, bakit yung mga less than 30 years old? Kasi this is the time when especially the adolescents, and young adults, they are more adventurous. Okay? And since nakukuha siya sa vehicular accident, sila mostly yung nasa motorcycle, they use motorcycles. And dito mas prone ng injury, or because of the accident, nagiging prone for spinal cord injury. So most common vertebrae involved are your C5, C6, C7, T12, and L1 because they have the greatest ROM or range of motion. Okay, natatandaan nyo pa ba guys your spinal cord? Can you still remember your spinal cord? Yes? No more. Lord, alam nyo pa? You have your cervical, thoracic, lumbar, sacral. Natandaan pa ba? Ay, fourth year. Do we need to review? Do we need to review or alam? Am I audible po? Audible po ba ako? Hello po?
Yes po.
Hello? Okay, sige. Can you still remember? Sige, review tayo. Ay, nako. Wait po. I'll share my whiteboard. Okay, sige po. So, your spinal cord, no, is made up of different regions, no? You have your cervical. Yung cervical natin, di ba, kung natatandaan nyo, you have C1 to C8, right? And then you have thoracic. Yung thoracic naman is T1 to T12, right? And then you have lumbar. Okay. O, ilan naman yung lumbar ninyo? Sige nga. Ilan yung lumbar ninyo, guys? L1 to L? L1 to L? Ay, afo. Section D, L1 to L? 5. Ay, ba't wala pong sumasagot? And you have sacral, no? You have your S1 to S3. S1 to S3. Okay. So, ano yung parts of the body that is being controlled by your cervical spinal cord, no? Your C1 to C3, please tell me if you already know this one so that we can skip. Wala po kasing sumasagot. That's why I'm continuing. No, you have your neck muscles, 'di ba? Your C1 to C3. Okay, another one, your C4, which is the most important probably na cervical spinal cord. Why? Because it innervates your diaphragm. Okay. So once yung C4 yung affected na na-paralyze si diaphragm, wala na. Your breathing, there's breathing cessation. You know that the diaphragm is the most important muscle in breathing. No, so usually yun yung nagiging cause ng death, sudden cause of death, no? Deltoid, no? Your C6 naman po is your wrist. Okay. Your C7 is your triceps. And your C8 is your C7 and C8, no? Is your fingers. Ayan. How about for your thoracic? For T1, it's the hand. For T2, trunk or your intercostal muscles. Okay. And then, additionally, for T7 to lumbar 1, abdominal muscles. And then for T11 and L2, ejaculation. Yan. How about for lumbar? For lumbar po, L2, we have hips. L3, we have quadriceps. L4 to L5, we have hamstring or your knees. L4 to S1, we have foot. For sacral, syempre, pababa na tayo. Ayan, S2, penile erection. And S2 to S3 is bowel and bladder. Okay. So you get this one? Okay na po sa inyo? Do you understand? So kunwari, yung definition natin kanina ng spinal cord injury, kunwari po ang affected is your C5. So you expect that the extremities, the upper extremities are affected down. Upper extremities down. Affected na po yan. Okay? So kunwari naman, it's your T12 that is affected. So you expect that from trunk down, nagkakaroon ng paralysis or hemiplegia. Okay po. Na-get niyo po? Can I delete this one na?
Yes, ma'am. Yes, ma'am.
Okay, so let's proceed. What are the causes or factors leading to spinal cord injury? Traumatic spinal cord injury may stem from a sudden traumatic blow to spine that fractures, dislocates, crushes, or compresses one or more of your vertebrae. It may also result from a gunshot or knife wound that penetrates and cuts the spinal cord. A non-traumatic spinal cord injury may be caused by arthritis, cancer, inflammation, infection, or this degeneration of the spine. So, common causes, you have motor vehicular accidents, falls, acts of violence, sports and recreational injuries, alcohol, and diseases. Risk factors po natin, more common among male between age 16 to 30 years old, engagement in risky behavior, ito yung mga mahilig mag-adventure, no? Ano yon yung behavior kasi talaga ng ages 16 to 30, this is the time when an individual seek for more adventure, become curious of trying something new, kaya nagkakaroon ng high risk for injuries, having a bone or joint disorder. What are the signs and symptoms? Emergency signs and symptoms of a spinal cord injury after an accident may include, number 1, extreme back pain or pressure in your neck, head, or back, weakness in coordination or paralysis in any part of your body, numbness, tingling, or loss of sensation in your hands, fingers, feet, or toes, loss of bladder or bowel control, difficulty with balance and walking, impaired breathing after injury, and an oddly positioned or twisted neck or back. Other symptoms, loss of movement, loss of sensation, including the ability to feel heat, cold, and touch, loss of bowel or bladder control, exaggerated reflex activity, spasm, changes in sexual function or sexual sensitivity and fertility, pain or an intense stinging sensation caused by damage to the nerve fibers in your spinal cord, and difficulty breathing, coughing, or clearing secretions from your lungs. So, it really depends on which part of the spinal cord is injured, no? So, depende yan kung saan or kung anong part yung na-injure, yun din yung manifestation niya. Like for example, lumbar. Pag lumbar yung involved, you expect that there is probably, depending on the severity nagkakaroon ng difficulty of walking, nagkakaroon ng minsan nga inability to walk na kasi paralyzed na talaga yung yung lower extremities. Nagkakaroon din ng problem with penile erection sa mga lalaki, no? Nagkakaroon ng loss of control sa bowel and bladder. So, yon. Depende po yan sa part ng spinal cord kung saan siya ay na-injure. Complications, areas often affected include bladder control, which is changes in bladder control, your UTI, primarily, lalo na yung mga nagkakaroon na ng incontinence because they lost bladder control, circulation control, circulatory control ladder, nagkakaroon ng autonomic hyperreflexia, respiratory system, pwedeng magkaroon ng pneumonia kapag ang affected part dyan is your cervical. So kapag ka-affected cervical, you expect that there is a problem with breathing, there's a problem with respiration. Kapag na-loss ng patient ang coughing ability niya, so secretions are retained. So once these secretions are retained, inability to cough out these secretions or to eliminate these secretions, pwedeng magkaroon po yan ng pneumonia. Okay? And another one, syempre kapag confined na sa bed yung patient for quite a long time, the immobility may result into pneumonia. Muscle tone, you have your spasticity and flexicity. No? And you also have your fitness and wellness, nagkakaroon ng weight loss and muscle atrophy. Kapag hindi natin nagagamit yung muscles natin, this is a complication for those who are bedridden due to spinal cord injury, no? If muscles are not used for a long time, they suffer from atrophy. Okay? And sexual health, nagkakaroon ng problem with fertility. Test and diagnosis, we do history taking, physical examination, x-rays, CT scan, and MRI. What are our management? So we have emergency actions. Don't move the injured person. Permanent paralysis and other serious complication may result. So immobilize the patient immediately so as not to aggravate an existing injury. Call your local emergency medical assistance number. Keep the person still. Place a heavy towel on both sides of the neck or hold the head and neck to prevent them from moving until emergency care arrives. So ang goal po natin dito, of course, you still have your ABCs. You need to access for the airway, breathing, and circulation. Apart from that, it's very important not to move the patient if it's not really necessary. Maintain the patient in a neutral position so as not to aggravate an existing injury. Provide basic first aid such as stopping any bleeding and making the person comfortable without moving the head or neck. Okay. So we need to maintain breathing, prevent shock if there are you have your neurogenic shock. It's important that we assess the condition of the patient. Signs and symptoms of shock must be assessed in order to give prompt interventions. Immobilize neck to prevent further spinal cord damage. So avoid possible complications, give medications. We give methylprednisolone. This is a treatment option for an acute spinal cord injury to prevent further inflammation and edema. Immobilization, traction is needed to stabilize spine, to bring the spine into proper alignment or both. And if there's a need for surgery, so the goal here is if there's really a need for surgery, it must be promptly done. Why? Because postponement of any interventions may result into a poorer prognosis. So prompt treatment is necessary. So often surgery is necessary to remove fragments of bones, foreign objects, herniated discs, or fractured vertebrae that appear to be compressing the spine. Ongoing care, so after for example, a surgery or during the rehabilitation, after the initial injury or disease stabilizes, doctors turn their attention to preventing secondary problems that may arise, such as deconditioning, muscle contractures. These muscle contractures might be a complication of being immobile for quite some time. no, nagha-harden and nag-i-stiff yung mga muscle joints natin. Pressure ulcers, a complication of prolonged confinement in bed, bowel and bladder issues, okay, and respiratory infections and blood clots. So the length of hospitalization depends on condition and the medical issues PT facing your physical therapy. Once PT is well enough to participate in therapies and treatment, may transfer to a rehabilitation facility. So, usually saan sila dinadala? So, pagka nag-rehab yan, sa PT na physical therapy yung patient natin, no? Depending on what extent yung kanilang injury and if it is still reversible. So, medical management, we give high dose corticosteroid to prevent inflammation, no, improve the prognosis and decrease disability if initiated within 8 hours of injury. Patient receives a loading dose and then a continuous drip. This is your methylprednisolone. We also give high dose of steroids, mannitol, and dextran. We also give naloxone, which has shown promise in use on humans. Minimal side effects may promote neurological improvement. Okay, so for a while po I'll just reply po. Okay. Ayan. So any questions po? Any questions so far? None. If there are no questions, then we proceed po. Surgical management, we have discectomy, no, removal of herniated or extruded fragments of intervertebral disc, laminectomy, which is the removal of the lamina to expose the neural elements in the spinal canal and allows the surgeon to inspect the spinal cord, identify and remove tissue for pathology, and relieve compression of the cord and roots. Laminotomy is the division of the lamina or a vertebra. So, discectomy with fusion. This is a procedure which involves a bone graft from iliac crest or bone bank is used to fuse the vertebral spinous processes. The object of spinal fusion is to bridge over the defective disc to stabilize the spine and reduce the rate of recurrence. We also have fixation and fusion. Fixation involves stabilizing vertebral fracture with wires, plates, and other types of hardware, while reduction is a procedure wherein the spine is realigned through the application of a skeletal traction device such as your Gardner-Wells tongs or your halo traction. Nursing management, we assess, we observe for the breathing pattern. A strength of cough is assessed. Lung is auscultated to look into secretions, no, retained secretions. Closely assessed for the symptoms of progressive neurologic damage. Motor and sensory functions are assessed through neurological examination. Monitor temperature, lower abdomen is palpated for signs of urinary retention. Nursing diagnosis po natin, ineffective airway clearance related to weakness of intercostal muscles, impaired physical mobility related to motor and sensory impairment, disturbed sensory perception related to motor and sensory impairment, risk for impaired skin integrity related to immobility and sensory loss, urinary retention related to inability to void, constipation related to presence of atonic bowel as a result of autonomic disruption, acute pain and discomfort related to treatment and prolonged immobility. Nursing interventions promote adequate breathing and airway clearance, improve mobility. We always prioritize breathing and circulation even doon pa lang sa immediate care natin up to the emergency department and until the long tawag dito, long care, no? Breathing and airway is very important or are very important. Improving mobility in order to prevent prevent pressure ulcers from developing, in order to prevent contractures, okay? Promote adaptation to sensory and perceptual alterations, maintain skin integrity, maintain urinary elimination, improve bowel function, and provide comfort measures. Monitor and manage potential complications like thrombophlebitis, orthostatic hypotension, autonomic dysreflexia, and promote home and community-based care. Okay. That's all po. Do you have questions? Questions po?
Wala po, ma'am.